Okay, so this first case we're going to look at is a 22-year-old pregnant woman who was completely asymptomatic.
Okay.
I'll now show you the images. Good. Now, I'm going to back up through the images slowly. Okay, we'll now go to the first image and you can comment on that.
So the first thing, I think you always want to identify where certain things are and orient yourself. So we see the spine here.
Right.
And so these are probably ribs. But you also need to notice that there's some echogenic foci anteriorly at the level of the abdomen. So these could be lower ribs, or they could be more of what's going on here. Same thing here, several echogenic foci. This is most likely a rib, but these probably aren't. More echogenic foci surrounding the peritoneal surface. And more of the same.
Okay.
So I'm going with meconium peritonitis.
That is correct. Now let's go back and let me show you how I go through some of these things. Again, your first observation was excellent. The first thing you have to do is to orient yourself to where are you in this fetus. When you see the spine here and you don't see ribs, there's only two possibilities, the neck or the abdomen. Right. So obviously that's not a neck, so we're already good. We know we're in the abdomen. And this is, there's three fluid-filled structures that are commonly seen in the abdomen: stomach, umbilical segment of the left portal vein, and the gallbladder. This, in the dead center of the fetus, almost certainly is the umbilical segment of the left portal vein. So we know that this tissue has to be liver, and therefore this is something between the abdominal wall and the surface of the liver. Now we go back here. We again see the spine, the aorta. Here is a rib. And you'll notice that this thing goes too far anteriorly to possibly be a rib.
Right.
You can see some of the stomach. And you can see that if this continues on course, it will pass under the rib. Okay. A couple additional dots. Here is a rib. Similarly here, spine, rib. These are too far anterior to be ribs. And the same thing here. We see the gallbladder and a blotch of calcification on the peritoneal surface. The hardest thing is to make sure you're not looking at a rib, because your brain wants you to think, I'm looking at ribs. So you need to see a rib to know that this is too anterior to be a rib. Your diagnosis is exactly correct. This is meconium peritonitis. What happened to this fetus?
Bowel perforation.
That is correct. The fetus perforated the bowel, enabling meconium to spill into the peritoneal cavity, where it's an irritant and undergoes dystrophic calcification.
No.
That is correct. This is not a lethal anomaly by any stretch of the imagination. Such fetuses can have bad things going wrong with them, but they're not going to die from this problem. In fact, the bowel that ruptured in almost every instance, not every instance, heals by the time the fetus is born.
Cystic fibrosis?
That is correct. Cystic fibrosis and infection. And these can both be checked by their obstetrician. You can't rule out every case of cystic fibrosis, but you can rule out a whole bunch of them.
I don't know.
Well, generally speaking, if there's no evidence of bowel dilatation and there's not a meconium pseudocyst, the prognosis tends to be pretty good for these fetuses. In fact, it's not at all unheard of for these children to leave the hospital with meconium peritonitis completely undiagnosed and not diagnosed until they're 4 or 5 and get a KUB for reasons that God only knows.
Right. Thank you.